Welcome back to the Buttercup Bakery Food Safety Induction and Refresher Training. This is part 2, where we will be discussing personal hygiene. People carry food poisoning bacteria in their ears, nose and throat, and on their skin and hands without knowing it. If you do not have good personal hygiene, food may be contaminated by your body, clothing, and hands. Bacteria in food may make a customer ill. When you complete this topic, you will be able to describe good personal hygiene practices, explain what harm can be caused by smoking near food, handling food when you are unwell, not being clean, not washing hands often and thoroughly, wearing things which can contaminate food, as well as demonstrate how and when to wash your hands. Personal hygiene. It is very easy for your hands, clothing, nails, hair, and jewelry to contaminate food or a food preparation surface. Good personal hygiene means making sure you are clean, wearing clean clothing, and washing your hands thoroughly and often. You can contaminate food with bacteria. Working with food means that you are responsible for practicing good personal hygiene. To prevent food contamination, do wash and dry your hands thoroughly. Keep your nails short and clean. Keep your hair clean, tied back and covered at all times. Wear protective clothing to protect food from contamination. Keep personal belongings and clothing in a locker or changing room. Take your apron off before going to the toilet or going outside the food preparation area. Cover all cuts and wounds with a waterproof, brightly covered plaster and a glove. The bright color makes it easier to find if it drops in the food, and the glove will stop it falling in the food. To prevent food contamination, don't touch ready-to-eat foods with unwashed hands. Wear artificial nails as they can fall off into the food. Smoke near or around food or preparation areas. Wear nail polish as it can chip off into food. You also won't be able to see if your nails are clean. Touch or comb your hair when preparing food. Wear rings, earrings, or body piercings as they can fall into food. Touch your face while producing or packing food. Go to work if you are unwell, especially if you have diarrhea, vomiting, or fever. Eat or drink over unprotected food or food preparation surfaces. And don't store personal belongings and clothing in food preparation or food storage areas. Washing your hands. When handling food, you must wash your hands regularly and thoroughly. Hands should be washed in the hand washing sink and not in the dishwater or food preparation sink. When to wash your hands. You can reduce the chance of contaminating food with bacteria by thoroughly washing and drying your hands after going to the toilet, every break, eating and drinking, smoking, handling raw food such as meat, chicken, and eggs, blowing your nose, using a tissue or handkerchief, handling rubbish, touching your ears, nose, mouth, or other parts of your body, handling your mobile, keys, or personal items, and touching animals and people. How to wash your hands. Use a designated sink provided for just washing hands. Apply liquid soap and use warm water. Wash your hands for at least 20 seconds, including between your fingers, under your nails, the back of your hands, thumbs, and wrists. Rinse under warm, running water, bearing in mind the taps operate via a sensor and it is not necessary to touch them. Dry your hands using a paper towel and then sanitize your hands. Using and wearing gloves. Gloves can be a great way to prevent contamination of the food you are preparing, but used incorrectly, they can contaminate food just as easily as your bare hands. In South Africa, it is not compulsory to wear gloves if you are working with food. However, it is compulsory to wear gloves if you have a cut or lesion on your hand. Changing your gloves frequently is one of the best steps for making sure the food you handle is safe. Always change your gloves between handling ready-to-eat and raw food. If the gloves tear, between different tasks, after taking the rubbish out, after sweeping, mopping, and cleaning, after taking money or providing change to a customer. If you use gloves, remember that they can contaminate food as easily as your hands. Always wash and dry your hands before putting on new gloves. Smoking and food handling. You must not smoke when handling food, as ash, cigarette butts, and smoke can all contaminate food. When you smoke, harmful bacteria pass from your mouth to your hands and then onto food. Smoking is banned in all indoor areas across South Africa. This includes restaurants, cafes, takeaway shops, pubs, and other licensed premises. No smoking rules. You are not allowed to smoke where food is received, stored, prepared, served, transported, or eaten. If you smoke a cigarette, make sure you wash your hands thoroughly before returning to work. South African law prohibits smoking in food preparation areas and storage areas and where food is served and eaten. Feeling unwell. There are many reasons why a food handler might decide to go to work or stay at work when they are feeling unwell. However, none of these reasons are important enough to risk infecting customers or colleagues with whatever illness you have. If you're unwell, stay home or go home. Symptoms of illness. If you are working as a food handler, you must not work when you have symptoms of diarrhea, vomiting, fever, and yellow eyes and skin, which is an indication of jaundice. These can be the symptoms of food poisoning or infectious disease, which could contaminate the food that you are handling and cause other people to become unwell. Food poisoning bacteria can be found in soil, on animals, people, and on things people touch and use, such as your mobile phone and keys. Some bacteria can multiply to many millions in a short period of time. Lack of proper personal hygiene can be a major risk to the food you handle. You should not work when you are unwell, and you should see your doctor and tell the doctor you are a food handler. Your doctor will determine when it is safe for you to return to work. It is your responsibility to avoid contaminating food or infecting other staff members and customers. Do advise your supervisor as soon as you become unwell. Go home if you feel unwell. See your doctor and tell them that you work with food. Stay home until 48 hours after symptoms have stopped. Check with the doctor about when you can return to work. Don't go to work if unwell. Don't handle food at work. And don't be pressured into returning to work if you are not well. Some diseases that cause food poisoning do not last very long, but others, such as typhoid, may result in hospitalization and a lengthy time off work. Your doctor or the government health department or clinic will advise you when you are clear to return to work if you have an illness that by law means you cannot work with food for an extended period of time. That completes part 2, personal hygiene. Please open the next presentation, which is part 3, food handling.